Okay, so now we're going to do a cardiovascular assessment of the adult patient. So any past medical history would be asked. We're going to collect subjective data. So if the patient has had any past medical history, cardiovascular related, if they have high blood pressure, if they take any medication for that, if they've had any cardiothoracic surgery, all of that would be assessed. And then again, we're going to start with inspection, look at the general appearance of the patient. When we assess the head and neck, at that time we could also check the carotid. We can look at the jugular to see if there's any jugular distension. We're just going to look at the color of their skin. We would check their blood pressure, we would check their pulse. That would tell us a lot, and then we're going to listen for any bruise in the carotid area, and then we're going to listen for all the pulses. We'll check for the intensity, pattern, quality, and location. And we could do some percussion, but that's just going to be to estimate the size of the heart, but we would not be doing that now. But we would look for aortic pulsation. Okay, so I'm going to just take a listen again. First, I'm going to listen to your carotid, that's in your neck. Now I'm listening to the heart. Checking the radial pulse as well. So I can check for radial pulse on both sides. And the heart is S1 and S2, and there is no murmur. I didn't hear any extra sounds, any gallops. We can also look at the lower extremities and check for pedal pulses, see if there's any edema around the ankles or anywhere below. We can check for posterior tibialis, popliteal pulses on both sides. Also, just looking at the circulation in their hands and their feet will tell us about their cardiovascular system. And that is the end of this part.